it's unknowingly affect our own body tissues. So in these conditions, the patient has the joint pain, stiffness, swelling, etc. Then autoimmune diseases like SLE, scleroderma, those conditions also, the patient can get the joint pain. So the role of the physiotherapy is very effective to manage the pain without taking the painkiller. So patient has to understand how the physiotherapy treatment is effective in arthritis treatment. Because all the patients will think if I start the exercises, the pain get worsen and my joint get will damage. This is totally the wrong statement. If you not doing the exercise, that joints will go for the stiff, the swelling will persistent. You can't able to do the aerial activity in the better way. When you start doing the exercises, you from the this it that chemical, it will release the chemicals that name is endorphin. It is connected with some receptors in the brain. It will reduce the pain. So the endorphin, it will act like a painkiller. So when you start doing the exercises, the endorphin will release more. So that time your pain status also will come down. So before starting the exercise, make sure consult the physiotherapist, because in arthritis, each and every patient has the unique clinical features. Not only the rheumatoid arthritis patient has joint pain. In autoimmune disease like SLE patients also can get the joint pain. So in rheumatological and immunological field, each and every patient has the unique clinical features. So there is the no protocol for arthritis management. It is a customized treatment for each and every patient. So before starting the exercise, make sure consult the physiotherapist first. What kind of the exercise have to do, how many repetition. Exercise prescription is very, very needed. Because if we are unknowingly doing that more repetition of the exercise, it will also worsen the pain. So how much you have to do, how much repetition, what kind of the exercise. Get the prescription from the physiotherapist. So please, all the arthritis patient has to consult the physiotherapist to manage your pain and the aerial activities. One more, that physiotherapy can help to lead the lifestyle. You can able to do the aerial activities better. So if because in arthritis patient they can't able because they had the pain in the hands and pain in the knees, they can't able to walk properly. They can't able to comb the hair properly. The small aerial activities affect more in arthritis patients. These are how they can come out from of this. So you just take a consultation with the physiotherapist. They will assess you properly. Then which joints get affected, any muscles can affected, which joints got that stiffness. So accordingly, we can plan the management. Accordingly, we'll teach the exercises, we'll teach the home program. So those exercises you have to do it. Important is the home exercise is the big deal in arthritis field, because in arthritis, the patient has to move the joint. The stillness will increase the stiffness only. So move the joint, keep around. Keep moving the joint frequently. If you are not moving the joint, the stiffness will occur very soon. So for that, you have to do the exercises regularly. If we because in our hand, the patients will be the half an hour to 1 hour. The remaining the 23 hours in their hand only. So exercise program is very, very needed in arthritis patient. So do the home program in a proper how we are giving the schedule, that according those schedule you have to do the exercises regularly. Then in some of the cases the patient have stiffness, some of the deformities will have can see in that arthritis patient. So those deformities are you can corrected by the splints. The splints also some patient will tell, so I am using the splint, it will get the pain more. So you just get the consultation first of how you have to use, how many hours you have to use. After removing the splint, what are the exercises you have to do? Those are the protocol also get from the physiotherapist. It will helpful to prevent the deformities. That weight reduction also is the major role in arthritis patients because already the joint get that affected. If the weight is more, the stress on the joint is also affecting more. So weight management also playing a major role in arthritis patients. So do the exercises like aerobic exercises like walking, swimming, cycling, those less stress activity exercises to make a plan for every day on your work schedule. So not only for the weight reductions, one more in arthritis patients, there will be always elevated in inflammatory parameters like CRP, ESR. That increased ESR level, it leads the thickening of the blood vessels. So it leads to some of the cardiac diseases. So for preventing those kind of the cardiac diseases, we have to concentrate the cardiac activities like aerobic exercises. It will help to reduce those complications in your life. Then exercise, before starting the exercise, if the pain is more, you just give the hot water fermentation and get the pain status calm down. Then you just start doing the exercise. You before starting the exercise, think one, you just respect the pain first. If the pain is more, don't avoid the exercise, just to do the exercise the lesser repetition side. So usually you are doing the 10 count of the one shoulder exercise, the pain is more on your shoulder, just to cut down to the 5. Don't fully stop those exercises. If you stop the exercises, that joint go for the stiffness, the surrounding muscles also get weakness. So before starting the exercise, keep it in mind. Respect the pain. According the pain, you just to plan your exercise program. Then plan your day. Don't rush and do all activities at a stretch. It will stress your joint also. You get the more pain. Plan the day accordingly. You just divide the work. You just do the work for the half an hour and take a rest. Then again do for the other works. If you are doing the exercises, you can't able to do exercise at a one stretch also, you can split and do it. If the pain is more, you just plan that upper limb like shoulder, wrist, fingers, those exercise you just do at the morning. Then do the lower limb exercise like ankle, knee, those exercise you can do in the evening. Just split and do the exercises, don't put the exercises. Then weight management also is very needed. So get that diet control, do the good diet control and do the aerobic exercises and do the free exercises. And to preserve the joint, you have to move the joint in frequently. So don't freeze the joint. If the pain more also, you just take a painkiller and start moving the joints. Then some of the joints will get already stiff also. There are some physiotherapy treatment are there to come out from the stiffness. Like wax therapy and mobilization will give the wax, will loosening the surrounding adhesions tissues. Then we'll start doing the mobilization. You can come out of the stiffness. For the pain management also, we have a lot of modalities like interferential therapy, ultrasound therapy, short wave diathermy, hot pack, cold pack. Some of so many pain relieving modalities are there to reduce the pain, and we can plan accordingly. After the pain reduction, we'll design the exercise program. So our conclusion is, in arthritis patient, exercise is a major role in that one. So do the exercises regularly, avoid the deformity. To prevent the deformity, you have to do the exercises regularly, move the joints. If pain is more, just consult your doctor and get the physiotherapy consultation also. Accordingly, plan your exercise program. Don't skip the exercises. Do the exercises regularly, and you can get the best ADL activities in your daily life. So, my concern: do the exercise regularly and get the physiotherapist consultation on properly. You can do the exercises. Along with exercise, plan the medications. You can lead the lifestyle in good manner. Thank you.